The pandemic is causing a Botox boom. Now that face masks are mandatory as an accessory, there's increased attention on people's foreheads, which is driving up demand for fillers. Now there's another eye-opening trend plastic surgeons are seeing as well, and that's eyelid surgery. Dr. Franklin Rose with Utopia Plastic Surgery and Med Spa joins us live now to talk about that. Good morning, Doc. Now, because we have masks, a lot of attention is drawn to the forehead. But that's not the only type of procedure you're seeing right now. It's foreheads and eyelids?
That's correct, Jose, and good morning to you. Yes, eyelid rejuvenation. Patients in the Middle East have known this forever because of Shadur's. Certain, like Marc Jacobs, certain beauty designers, there's a lot of focus on eyelid surgery right now because of surgical masks, as you mentioned. Here, I'll put mine up for just 1 second here. And so you can see when the masks are up, the eyelid comes in, the eyes come into focus.
So COVID for some has brought attention to, I don't want to say they're, well, they just want to look better and not show. But when you have lines in the forehead, that's kind of normal, isn't it?
Yeah, well, eyelid surgery has always been very popular, but not just in our practice, but really across the nation. There's really an uptick, if you will, in the number of what's called blepharoplasty, and we combine, which is eyelid rejuvenation, combined with Botox, sometimes microblading to kind of rejuvenate the eyebrow. I mean, there's just so much more focus on the eyes, eyelids, eyebrows, so-called crow's feet. And it's just, this area is masked, the lower half of the face. And so the upper half of the face is drawing a lot of attention just because of the face masking requirements.
Okay, the eyelid surgery, what does it entail and how long is recovery?
So the name of the operation, again, is blepharoplasty. The procedure only takes about 1 hour and 15 minutes. Recovery is actually rather quick. I mean, this procedure is outpatient. Patients can do this on a Thursday or Friday. Sometimes bruising and swelling of a variable nature, usually minimal, can go back to work that following Monday, 8-9 days, 10 days after the procedure. So it's a rather speedy recovery compared to other procedures.
What about scarring?
Oh, minimal. I mean, no scarring. You can't leave scars on these cases. I mean, tucked away in the little crease above the eye and just underneath what's called the ciliary lash line. So no appreciable scarring. No scars, really.
Real quick, who would be the ideal candidate for this procedure?
Well, really, it's patients, really even starting in late 30s when patients start getting a little eyelid hooding, a little so-called bags under the eyes. Really, I mean, I've done patients in the early 30s all the way up to 80s, male and female. Actually, the last blepharoplasty we did was last week on a male attorney. So male and female are good candidates.
Okay. Doc, great information. Thank you so very much for joining us this morning. Dr. Franklin Rose from Utopia Plastic Surgery and Med Spa.
Thank you, Jose.
9:46.